Imagine, for just a second, a perfectly normal Saturday. You're out in the garden, you're pulling some weeds, and you scrape your hand on a rusty piece of wire.
Right. Just a minor scratch.
Exactly.
Yeah.
Or maybe you're dealing with a teenage acne breakout. Or you wake up with, a routine sore throat. Nothing. A quick trip to the doctor and a round of basic antibiotics can't fix, right?
Yeah, that's what we've all been taught to expect.
But now imagine going to that doctor and instead of writing a prescription, they look at you and say, I'm sorry, but the antibiotics we've relied on for nearly a century, they simply do not work anymore. We have nothing to give you.
It is a terrifying thought. You go from a minor inconvenience to a literal life-threatening crisis in the blink of an eye.
Yeah.
And yet, looking at the data we are poring over today, this isn't, the plot of some dystopian science fiction movie. This is the very real, very fast approaching reality of antimicrobial resistance, or AMR.
Welcome to this deep dive. Today we're looking at a massive global health crisis, the silent pandemic of AMR.
And it really is silent.
It is. We're going to explore the structural roadblocks facing these massive global institutions like the World Health Organization, and most importantly, we are going to look at a truly revolutionary solution emerging right out of India.
Which is just a fascinating twist in the story.
Totally. Our mission for the next bit of time is to understand how a completely reimagined approach to universal healthcare could not only save struggling global health bodies billions of dollars, but how a simple solar-powered kiosk at a local bus stand could quite literally prevent the next pandemic.
Yeah, putting the power of public health directly into the hands of your community.
Exactly. So to truly grasp the genius of this solution, we have to first look the problem right in the eye.
Right. And the data on antimicrobial resistance is, well, it's sobering. We are currently losing over 1 million people a year globally to AMR.
1 million, wow.
Yeah. But the trajectory is what keeps public health officials awake at night. By the year 2050, we could be looking at 10 million deaths annually.
10 million every single year. That number is so large, it almost, it loses its meaning.
It does. It becomes a statistic.
Right. But there was a specific metric in the NHS proposal documents we reviewed that really grounded this in everyday reality for me. It was the success rate of routine medical procedures.
Oh, yeah. We are talking about the foundation of modern medicine here. Safe childbirths, cesareans, cancer treatments, organ transplants.
Joint replacements, like getting a new knee or hip.
Exactly.
Yeah.
As of 2023, the failure rate for these routine procedures due to resistant, untreatable infections, it crossed a highly dangerous 40% threshold.
Wait, 40%?
40%.
That means nearly half of the time someone goes into a hospital for what we consider a standard, totally safe procedure, there is a risk that the antibiotics will fail to protect them from a post-operative infection.
Yep. It's like we're just quietly sliding backward into the 1920s.
Into a pre-antibiotic era.
Exactly. And without anyone really sounding the alarm on a mainstream level. And our current global health systems are, frankly, buckling under the sheer weight of this.
Take the World Health Organization, for example.
Right. They have historically done monumental work eradicating smallpox, pushing polio to the brink of extinction.
But the current landscape is exposing severe systemic vulnerabilities, like the WHO has faced crippling funding cuts. There was a $300 million reduction in 2020 alone.
Yeah, and they're navigating massive bureaucracies. They faced heavy scrutiny for being reactive rather than proactive.
Which we saw during the West African Ebola outbreak.
And, of course, during the early days of COVID-19. By the time the global machinery spins up, the fire is already completely out of control.
And it isn't just a top-down problem with the WHO. Let's look at the national level, specifically in India, which is where this new technological solution originates.
Right.
Looking at the numbers from a Lancet report detailing global infrastructure, and just to be clear, we are impartially conveying the findings of this source material here, not taking any political sides. The report notes that the Indian government spending on health hovers at just 1.2% of its gross domestic product.
Which creates a massive vacuum. Meaning the out-of-pocket expenses for everyday citizens are just astronomically high.
Exactly.
And the human cost of that systemic gap is staggering. In rural India, the doctor-to-patient ratio is incredibly skewed. We are looking at just one doctor for every 30,000 people.
One doctor to 30,000 people.
Yes. And just to give you some context on how vast that gap is, the WHO's recommended baseline ratio is one doctor per 1,000 people.
Okay, let's unpack this, because this is the exact moment where my brain gets stuck.
Right. It seems impossible.
If the WHO, with all its billions of dollars, its decades of global infrastructure, and its international authority, is struggling to stop this AMR crisis, how in the world can a country dealing with such severe rural doctor shortages and a 1.2% healthcare budget possibly lead the charge in solving it?
What's fascinating here is that the very lack of legacy infrastructure in rural India is exactly why they are primed to leapfrog traditional medical models entirely.
Leapfrog them, like skip a step.
Exactly. Think about the telecommunications boom.
Oh,
Many developing nations didn't spend decades and billions of dollars laying down copper telephone wires to every remote village.
right. They completely skipped that step and went straight to mobile phones and cellular towers.
Precisely. Building the old infrastructure from scratch was too expensive, too slow, and frankly, already outdated. So India doesn't need to try and build thousands of massive, expensive, traditional hospitals that they can't even staff.
Because the solution isn't to centralize healthcare and force 30,000 people to travel to one doctor.
No. The solution is radical decentralization. And that brings us to the Prema Kiosk, powered by Dr. Maya AI.
Yes, the Prema Kiosk. Prema stands for Personal, Reliable, Empowering Medical Access. It was created by Dr. Kadiyali Srivatsa, or Dr. Shri, a former NHS doctor.
Right.
Now, I have to be honest, when I first read the term health kiosk in the sources, my mind instantly went to those glorified vending machines you see sitting in the corner of a chain pharmacy.
Oh, the ones where you shove your arm in a cuff to check your blood pressure?
Exactly. I pictured that, but this is not that at all.
Not even close. This is an AI-powered, solar and battery-operated community triage center. It's designed to work entirely off the grid.
Which is an absolute necessity for rural, resource-strapped areas.
Yeah. And remarkably, the interface speaks over 30 languages. It breaks down cultural, regional, and linguistic barriers instantly.
But how does a person actually interact with it? Like, does a farmer in a rural village have to stand there and type out their medical history on a giant iPad?
No. No, and that is where the Dr. Maya AI becomes crucial. It's an interactive conversational experience. The user speaks naturally into the kiosk in their native dialect.
Oh, wow.
Yeah. The AI listens not just to the core complaint, but it asks dynamic follow-up questions, much like a seasoned doctor would during an initial consultation.
And the clinical brilliance of this conversation lies in how it targets what Dr. Shri calls the silent spread.
This is a critical concept to grasp if we want to understand how to beat AMR. Antimicrobial-resistant organisms don't always announce themselves with a dramatic movie-style illness.
Right. They don't always cause a raging fever or hacking cough.
No, they often hide in plain sight.
The clinical reports describe this so vividly, like a person might have a painless pimple, a minor rash, or a small carbuncle on their arm that causes absolutely zero discomfort.
Yeah.
They don't feel sick, they have no reason to stay in bed, but they are a silent spreader.
Exactly. And people naturally assume that bacteria just stay localized on that little lesion.
Yeah.
But resistant bacteria and fungi, they colonize the surrounding skin.
Oh, gross.
I know, but they rub off onto clothes, they transfer onto mobile phones, and they can even become airborne in close quarters.
So this perfectly healthy feeling person gets on a crowded bus, goes to a bustling market, or worst of all, sits in a packed doctor's waiting room, silently shedding drug-resistant superbugs to everyone around them.
Which is the painful irony of our current system.
Huh.
Hospitals and clinics literally become the epicenters of the very outbreaks they are built to stop.
Right. So instead of waiting for these silent spreaders to show up at a crowded hospital waiting room, the Dr. Maya AI inside the Prema Kiosk intercepts them right in their own community.
And it does this by looking for a specific cluster of 3 subtle symptoms.
Okay, what are they?
Well, the patient might step up to the kiosk and not even mention the tiny rash because it doesn't bother them. But the AI is actively listening to the patient's overall story and identifying associated symptoms, things like excessive sweating, unexplained palpitations, or unusual lethargy.
Things a patient might easily dismiss as just being tired from a long day's work.
Exactly.
Let me push back on that for a second, though. Excessive sweating and lethargy, that just sounds like me on a Tuesday afternoon in July.
Right.
How does an AI know that my sweating is a deadly superbug and not just the weather?
It's a fair question. The AI isn't looking at one symptom in isolation. It's looking at the precise clustering of those symptoms combined with the patient's baseline data and real-time environmental factors.
Oh, I see.
It recognizes the nuanced pattern, the specific type of lethargy, combined with the heart rate, and realizes, wait, this points to an underlying hidden infection.
Got it. But here is a vital distinction made across all the project reports we looked at. The Prema Kiosk does not diagnose the patient. And it does not offer treatment or dispense pills.
Right. It triages, it
Oh.
guides people, and it uses a very clear, easy to understand, color-coded output to do so.
Yeah. If the kiosk flashes RED, that is an absolute emergency. It detects a life-threatening condition and immediately tells the user to call for an ambulance 999 in the UK or 108 in India.
And if it flashes BLUE, it flags an infection risk. It advises the user to see a doctor or a pharmacist within 24 hours, and it specifically warns them about the risks of antibiotics.
So it's educating them on the spot.
Exactly.
It's basically like a smart smoke detector for public health. Think about it. A smoke detector doesn't put out the fire, and it certainly doesn't try to rewire your house. It just tells you, hey, there is a very specific type of toxic smoke gathering in this room. Get out and call the professionals. By doing that, it prevents the whole building, or in this case, the entire community, from burning down.
That is a perfect analogy. It breaks the chain of transmission before the person ever steps foot inside a clinic.
Yes.
But the medical technology is really only half the story here. The way these kiosks are physically operated creates a massive economic paradigm shift.
Here's where it gets really interesting, because this was the most surprising part of the research, actually. We aren't just talking about dropping a piece of tech into a village and walking away.
No, not at all.
We are talking about empowering the grassroots. These kiosks aren't owned and operated by massive corporate healthcare conglomerates. They are managed by local people who are trained as community health navigators.
The logistics of this are brilliant. The model specifically recruits and trains homemakers, unemployed youth, retired individuals, and people from marginalized backgrounds to operate and maintain the kiosks.
There is this incredible humanizing story in the reports about a woman named Sumita Mandal from West Bengal.
Oh, I loved her story.
Right. She had migrated looking for work, struggling to make ends meet. She found this initiative, studied, and passed the written exam to qualify as a digital health worker. And her quote just stuck with me. Now we have earned enough and feel empowered.
It's amazing.
But what does her day actually look like? She isn't a doctor, so what is a digital health worker actually doing?
She is the bridge between the high-tech AI and the human reality of the village. She maintains the solar panels, ensures the machine is clean and functioning, but most importantly, she guides nervous or illiterate users through the process.
Right, providing that human connection.
Yeah, she provides the human empathy that a screen simply cannot. And by doing so, this technology actively lifts people, especially women and marginalized groups, out of poverty.
Which completely shatters the traditional demarcation between the rich and the poor in healthcare access.
Exactly. It shifts healthcare from being a highly medicalized, opaque, corporate black box into a community-owned public health economy.
Yeah.
It's healthcare by the people, for the people.
Yes. But, and this is a big but a heartwarming idea, is great, but to scale globally, it has to pay for itself.
Right, the economics have to work.
And the graphs and tables detailing the return on investment for the UK rollout are absolutely stunning. I actually had to read the margins twice to make sure I wasn't misunderstanding them.
Let's break those numbers down.
Yeah.
So in the UK, a traditional general practitioner visit costs the National Health Service somewhere between £39 and £82.
Okay.
A visit to the Accident and Emergency Department costs between £214 and £457.
It costs the NHS over £400 if I show up at the ER with a weird rash.
Yes. And a consultation at a Prema Kiosk costs just £5.
That margin is insane.
It is. Now imagine a kiosk sees just 10 users a day. That is an incredibly conservative estimate for a kiosk situated at a busy bus stand or outside a local pharmacy.
Right, you'd probably get way more.
But even at just 10 users a day, one single kiosk generates over £18,000 a year in revenue.
But it's how that £18,000 is divided that makes this a revolutionary model.
Right.
The revenue split is hard-coded into the system.
Right. It's not all going to a CEO.
Exactly. 25% goes to commercial profit that pays the local operator like Sumita, maintains the machine, and generates a return for the initial investors.
Then another 25% goes entirely to subsidize free care for the absolute poorest in the community. It guarantees that people on universal credit, pensioners, or asylum seekers can use the kiosk for free.
So the kiosk never turns anyone away.
Never.
And final 50%. That goes to the Dr. Maya Foundation. This funds global AMR awareness, and critically, it funds the deployment of more kiosks in poor nations across Africa, Southeast Asia, and more rural areas in India.
And the return on investment is staggering. The projection charts show that an initial capital cost of around £15,000 per unit results in a 1,052% ROI over 3 years.
1,052%.
Yeah, the kiosk literally pays for itself in just 3 to 6 months.
And that doesn't even factor in the massive amount of money it saves the broader healthcare system.
Oh, absolutely.
The year-one projection for deploying just 100 kiosks in the UK estimates over £15 million in avoided GP and A&E costs. It creates a completely self-sustaining ecosystem. It generates local income for a family while simultaneously bailing out bankrupt hospital systems.
Which perfectly positions this grassroots technology to become the ultimate hub for global pandemic prevention.
Okay, so it flags a silent infection in one person and it pays for itself. That's amazing for that individual in that town. But how does this scale up to actually stopping a global pandemic?
It's all about the network.
Right. Like, how does a network of solar-powered kiosks do the job of the World Health Organization?
If we connect this to the bigger picture, it comes down to data aggregation and integration. These kiosks do not operate in a vacuum. They form a massive, decentralized early warning data net.
Oh, I see.
In India, for example, the system integrates with the Integrated Health Information Platform, or IAT.
Yeah, I saw IIP mentioned heavily in the technical assessments. They talk about syndromic surveillance using Form S for syndromes and Form P for probable diagnoses. But what does syndromic surveillance actually mean for a layperson?
Think about it this way. Instead of waiting for a laboratory to process a PCR test and officially declare this is a new strain of COVID, which can take days or even weeks, syndromic surveillance just tracks the raw symptoms in real time.
So it doesn't wait for the name of the bug.
Exactly. It doesn't need the name. It just notices that, hey, 50 people in the exact same zip code are all coughing and showing high fevers on the exact same Tuesday.
Ah, so every time someone uses a Prema Kiosk, that symptom data is aggregated instantly and geotagged?
Right.
Because the AI is constantly looking for patterns, geographic clustering algorithms can spot an unusual spike in symptoms days before those people get sick enough to actually require hospital bed.
They literally see the outbreak forming on a digital map in real time before the local hospitals even know the virus exists.
And because the kiosk has identified these individuals at the very onset of their symptoms, it advises them to isolate at home immediately.
Yes, which is the most critical step.
Right. This prevents them from walking into the local pharmacy to buy cough syrup or sitting in the district clinic infecting the nurses and the vulnerable patients in the waiting room. You break the cross-infection chain at the source.
This is a total game changer for global health organizations. If we scale this model from India out to the rest of the developing world, nations with fractured infrastructure can suddenly offer universal primary triage at an absolute fraction of the cost of building traditional hospitals.
And think about what that does for the World Health Organization. If local communities are empowered to self-manage their primary triage and their own early epidemic surveillance through these self-sustaining microeconomies, it relieves an immense financial and logistical burden on the WHO.
Yeah, they can stop firefighting.
Exactly. It allows global health bodies to stop scrambling to put out grassroots primary care fires. They can finally step back and focus their billions of dollars on high-level biosecurity, advanced genomic sequencing, and rapid vaccine development.
Exactly. We've covered incredible ground today. We started by looking at the terrifying, fast-approaching reality of a post-antibiotic era.
Where routine surgeries become deadly coin flips.
Right, and where global health systems are collapsing under the weight of the crisis.
But we've seen how the ultimate solution might not be a multi-billion-dollar Western pharmaceutical intervention. Instead, it might be a decentralized AI-powered kiosk born in India, run by a local grandmother, acting as the absolute frontline defense for our global health security.
It's a profound shift in agency. We are moving from a system that relies entirely on centralized, often overwhelmed institutions to a system that empowers the individual and the community.
So, what does this all mean for you? Think about the last time you felt a little under the weather. How many times have you dragged yourself to a clinic, sat in a crowded, coughing waiting room for an hour, potentially exposing yourself to far worse bugs just to find out you had a minor viral infection that didn't even need antibiotics?
I've all been there.
Now imagine just walking down to the corner of your street, speaking to a screen in your native language for 2 minutes, getting a clear, color-coded answer, and getting the peace of mind to just go home and rest.
And this raises an important question, one that isn't entirely resolved in the reports we've studied today. If decentralized, community-owned AI kiosks become the primary way we monitor global diseases and secure our borders against pandemics? Who ultimately owns the story of our health?
That's a great question.
Is it the massive, struggling global institutions of the past, or the newly empowered local communities of the future?
That is a fascinating thought to leave on. Thank you so much for joining us on this deep dive. As you go about your day, the next time you get a simple scratch from the garden or a minor sore throat, take a moment to appreciate the antibiotics sitting in your medicine cabinet.
And think about the quiet revolution happening at a solar-powered kiosk half a world away, working to ensure those medicines keep working for all of us.